Homelessness. And we will be walking through the Continuum of Care spending template. We will, I'll first walk through the template, and then we will have some time for questions and answers later. Questions will be submitted through the questions box. So if you're looking at your GoToWebinar screen here, you should have this sort of box on the right side, and one of the little boxes in there should say questions, and you can type and submit questions in there. You should feel free to go ahead and type in questions during the webinar. We won't answer most of them until after the presentation, but you can type those in any time you want. So let me just sort of describe the spending template very quickly. Actually, before I start, a couple sort of housekeeping notes. First of all, we will we are recording this webinar, and we will make it available. We will email a link to this webinar to everyone on the call and everyone who registered for the webinar. Also, we have developed a short video, a 10-minute video that is on YouTube, and we will also send out the link to that video. The video actually is probably a better way to learn about the spending template and how to use it than the recorded webinar will be, but you can obviously use whichever one you like. So let me start by, let me go ahead and describe how the spending template works. So the spending template is created as an Excel workbook with several tabs. So let me just switch to my next screen here. So if you look at the very bottom of the spending template, there are those tabs. So you see them circled, and then we've sort of blown them up at the bottom so you can see them a little better. There are 7 tabs. The first one is an overview, and that just sort of gives basic overview information about the spending template and some very general instructions. And then there are 3 yellow tabs. One is lists, one is funding detail, and one is planned changes. I'll be walking through all these tabs individually, but what you should know is that in general the yellow tabs are ones where you enter information into the spreadsheet, and the blue ones are just ones that display information in different formats. So you are just going to be entering data into the yellow ones. So let's go ahead and take a look at this first tab here, which is the Lists tab. Also, just want to make a note here. What you're seeing here is just screenshots of the workbook. So this is not really live. I just sort of took pictures of various pages of the workbook. In some cases, I expanded them so and zoomed in essence. So that's what you're seeing here is screenshots of the workbook. So the first tab is the Lists tab, and the way this works is there are 3 sets of lists, a list of activities, a list of funding sources, and a list of organizations. The list of activities is something that is just what it is. So you don't add anything or change that list in any way. These are standardized categories of activities. The list of funding sources is something that you will likely add things to. So the intention of this list is to be a list of the various different types of funding sources that fund homeless assistance activities within your Continuum of Care region. So for example, some of the major ones are already listed there. There's the Continuum of Care, the Emergency Solutions Grants, and various other funding sources. But what you should do is think about, in your Continuum of Care, are there other funding sources, for example, foundations or private funders or county programs or city programs or anything else, and you would add those to that list. The third list is a list of organizations that provide homeless assistance within your continuum of care geography. So this is just a list of of the homeless service providers. There are a lot of homeless assistance providers provide more than one type of assistance. For example, one provider may do shelter and rapid rehousing and permanent supportive housing. You only list the organizations one time for this. Also, there are obviously organizations that provide services in many parts of the state. So they may provide assistance in your continuum of care, but also in other continuums of care. And that's fine. Some organizations are just going to be listed on more than one spending plan template. The template is really sort of designed to provide information about funding within your continuum of care. So this next screen here just shows an example of some of those things filled in. So I just, what I've done is sort of just added some more information so you can see how this template works. So you see we added a few other funding sources, and we just made a list of organizations. And you'll see how this all comes together in a couple minutes. And you just literally, click on those boxes and type those things in. So, so that's the lists tab. So let's go to the next tab, which is funding detail. And the purpose of the funding detail tab is to actually, let me zoom in here a little so we can see this a little better, and I'll show you a more blank one. So this is how you'll see the left side of the funding detail tab. On the right side, when you open this, what you'll see is a sample filled out, so you can see, just an example of how this might be filled out. So what you see is 4 columns here: the name of the organization, the strategy, the funding source, and the amount. And the way this works is it's going to put information from the lists tab into various drop-down lists. So let me just show you here. So what you can see here on this screen is that we put in the name of an organization, Organization A, and then when you click on the strategy box, there's going to be those 2 little arrows, the up arrow and the down arrow, and when you click on that, it pulls up this list. And this is the list of strategies that you saw on your Lists tab. So the reason you filled out that List tab is it helps you fill out this funding detail tab. So when you click on the organization box and click on the 2 arrows, it'll pull up all the organizations that you had previously listed. When you click on the strategy box, again, it'll pull up all the stuff from the strategy. And when you click on the funding source and click on the 2 arrows, it'll pull up a list of all the funding sources so that you can select from there. So so I went ahead and filled in sort of a sample of this stuff, and this is what it looks like here. So we put in, again, so name of the organization, the strategy that's being funded, the funding source for that strategy, and the amount. So let me just walk through this example in a little more detail because I think there are a lot of sort of nuances here. So first of all, you'll see that Organization A, they have 5 lines in this funding detail list. The reason they have 5 lines is because they have 2 different programs, so each program is listed separately, and each program has several different funding sources. So for example, Organization A runs a year-round shelter that's funded with 3 funding sources: the Emergency Solutions Grant, the Homeless Solutions Grant, and a bank that funds stuff, and we just made up a name of Bank Funder A. And then we put in the amounts that the Organization A gets to run the year-round shelter from each of those funding sources. A couple notes here. One is that for the purpose of the template, we're just rounding to the nearest $1,000, so you don't have to get super specific. The other thing is these are annual spending amounts. So, for example, if you get from a bank, you got a 3-year grant for $300,000. The annual amount for that is $100,000. And so throughout this template, the amounts that we're using are annual amounts. So again, Organization A has a couple different strategies that they provide. The year-round shelter and the rapid rehousing and the various different funding sources come together. Organization B has 2 transitional housing programs, a site-based transitional housing and a scattered site transitional housing with a couple different funding sources for each. And again, you can see how those are put in there. And we filled out a few other organizations as well. So let's now look at the, I actually wanted to show you one other thing here, which is that some of the boxes have this little red diamond or triangle in the top right corner. The way this works is if you just put your mouse over those cells, over the box, then this little pop-up box will show up that has some kind of instruction related to that box. So for example, in this one, if you just hover your mouse over where it says Organization A on the actual spending plan template, a box will pop up that says, click on a box below and then click on an arrow to choose an organization from the list. So again, anywhere you see those red triangles, you can put your mouse there and it'll tell you something. Hopefully it'll be useful information about that, what you need to do to fill out that box. So, and again, here is what that looks like, the example we've done filled out. So let's go to the next tab, which is the Planned Changes tab. So there are several parts of this tab. So I'm going to sort of slowly walk through this because it's there are a lot of just a lot of different parts to this. So first of all, I'm going to zoom in a little here. So this again is the same thing, but zoomed in a little. There are 3 major parts to this tab here. On the left side, under where it says strategies and total, and it has all those strategies underneath, is just a summary of the stuff we've already filled in. So when you filled out that funding detail tab, it sort of added everything together and it filled out this column for you. And what it's telling you is how much is being spent on an annual basis in your continuum of care for each of these strategies. This is not telling you which organizations or which funding sources, but this is just how much is being spent on each strategy. And then there's a green section, and this describes the changes you expect to see in the next 12 months. And there are several columns here, and I'll walk through these one at a time. But the green section is for changes that you expect to see in the next 12 months, and the blue section there is changes that you expect to see in the next 5 years. And again, I'll talk about these more in a sec. One little note here, this has some green triangles connected to some of those cells, and you can just sort of ignore those. They're not there intentionally. Okay, so let's walk again through this, zoom in a little more and walk through this a little more closely. So again, the part that I have shown in this red sort of circle-y rectangle here is the summary of what we had previously entered on the funding detail tab. So this is how much is being spent on various interventions. I just want to point out a couple things here. First of all, you can't put data into all of these cells. Some of these are summaries. So for example, at the top it says total, and there's 2,645,000. You don't enter that. It's just doing the addition there. And then right under there, there's a line that says temporary housing. emergency shelter, and there's a little asterisk 1 because there's a note at the bottom, but it says 320,000. Again, that's not something you're entering there. That's just the total of the 3 lines below. So you're entering data into the lightest colored cells, and the shaded ones, or in the case of the green and the blue areas, the darker shaded ones, are things that are just adding things up for you to provide higher level summaries. You don't have to add those things up or do anything with those things. I want to say a couple things about these various categories of things while we're here. So the strategies listed here, hotel and motel vouchers, overflow or seasonal shelters, and year-round shelters are the various emergency shelter categories. The transitional housing includes site-based programs, scattered site programs that use a transition-in-place model, and scattered site programs that do not use a transition-in-place model. And again, if you hover over these in the spreadsheet, it'll provide a little more information about those. The different permanent housing models include permanent supportive housing, rapid rehousing, and homelessness prevention activities. The services include employment, outreach, childcare, health, medical, and clinic services, substance use treatment or services, mental health treatment or services. There are several related to planning, oversight, and administration, including HMIS work, the coordinated assessment, and other coordination and planning activities. And then there is an other category. Now, you know, a lot of programs sort of overlap in many ways and cross a lot of different categories. In general, it was really intended to be so that you should, if a program is doing, for example, a transitional housing program is also doing employment services, you would just categorize that as a transitional housing program. As much as possible, you know, try not to make this more complicated than it needs to be. So, for example, you may have a permanent supportive housing program that also provides some child care. Really, that's just part of the permanent supportive housing program. The services programs are that category is intended to be for programs that are really kind of standalone programs that just provide that kind of service. So just wanted to make that note about this. Also, there are some things that just may not have a category, and there's an other category down at the bottom for those. It's probably better to try to shoehorn stuff into one of the categories above than it is to put a bunch of stuff in the other category if you you know, have to make those decisions. So that's that list of categories there. Let's look at the green section next. Okay, and so I'm going to go through this column by column. So first we're going to go through this new funding column. So what the new funding column represents is it represents the new funding that you expect to get in your COC in the next 12 months. So if it's something that it's funding that you already have, then that would have already been entered here. But this is maybe there's I don't know, a new grant program that's coming, or a funder has committed to providing funding but hasn't yet. So these should be entered into this column, and again, this should be on an annual basis. So for example, if you have a 2-year grant for $100,000, it would be you would enter $50,000 into this column. So I've sort of created some example entries here. For example, if there's a new if the county is going to provide some funding for a new motel voucher program of $50,000, then you would enter $50,000 into the motels or motel vouchers line. If there, you know, some organization is going to provide $100,000 in rapid rehousing assistance, you would enter that $100,000 into that rapid rehousing line, et cetera. So this is, again, new funding that you expect to receive. Now, that can also be a judgment call. If you've just applied for the funding but you're not sure if you're going to receive it, Generally, you wouldn't put that in those columns unless you were fairly certain you were going to receive this funding. So this next 12-month section is really about things that you really do expect to happen, either because you have pretty firm commitments or the wheels are already turning and it's just a matter of time before it happens. So, new funding column, new funding you expect to receive over the next 12 months. Let's look at the next column, which is reallocated funding. So the way the reallocated funding column works is that this is about resources that you, in the next 12 months, you expect to shift from one activity or one of the strategies to another. So for example, if you, in your Continuum of Care application, we're doing a reallocation project, so you were going to say reallocate from a transitional housing program to a rapid rehousing program, then those are the kinds of things you would enter into this column here. So again, I've put in a couple of examples, and this is a little more complicated than the other columns, so I'll walk through these. So for example, we have a reallocation of $100,000 from a scattered site transitional housing program to a rapid rehousing program. The way we enter that is we put negative $100,000 into that scattered site transitional housing program line, and we put $100,000 into the rapid rehousing line. So you, for the bookkeepers out there, this is everything should add up to 0 over the course of this column. So where you add stuff, you should be taking stuff out of a different line. And again, in another place, there's money being reallocated from an outreach program to a homelessness prevention program of $25,000. So again, we subtract $25,000 from the outreach line and put $25,000 into the homelessness prevention line. Again, we're rounding everything to the nearest $1,000 or so. And also, some of this, is somewhat speculative. You may know that you're going to get funding, but you may not know the precise amount. And so I think you just do the best you can to fill that out and make the best estimate you can. Let's go to the next column, which is the reduced funding column. And again, this works pretty similarly to the way everything else works, except that here you're looking at places where you expect to lose funding for some reason. For example, a year-round shelter may have had may be losing a $10,000 grant for some reason, and then you would put negative $10,000 into that line. And then what you have at the end of this process is, after you've filled all these out, is the new annual spending amount. So that's how much you're essentially going to be receiving or spending on an annual basis 12 months from now. So let's go ahead and head over to the look at the blue section next. And I'm not going to go through column by column at the blue section because the columns are exactly the same and you fill them out exactly the same, but they do represent a different thing, which is what you're trying to put in here is how much you expect to be spending 5 years from now on an annual basis for each of these activities. For example, let's take the example of the motel or hotel voucher. So currently we're spending $100,000 a year. The way this example works is we got a $50,000 extra grant that we expect in the next 12 months. But in this example, I'm assuming that we do not expect that to be permanent, so we expect that amount to go away. So we don't expect to be spending that $50,000 5 years from now. So it's 2013 now, so 2018, for example. So we don't put it in there. We only put in this blue section the annual amount of spending we expect to be spending 5 years from now. And Obviously, it's very difficult to make predictions, especially about the future, right? So this is going to be very speculative. You're going to have to make some projections about this stuff. But the main thing this is intended to represent is what your continuum of care is planning to do. So this is where your 10-year plans or the strategies that you're undertaking to improve your outcomes, to make your continuum of care work better, to shift resources around to more cost-effective and more effective strategies. This is where that's all represented. So let me again walk through sort of the examples here, and we expect that new funding that for a child care program that we had put in the new funding of the green section, the 12-month section of $50,000, we expect that to continue on an annual basis. So we again repeat it in this new funding column of the next 5 years of the blue section. We expect more money for HMIS, and so I put in, just for this example, $100,000 extra there. We applied for coordinated assessment. Say we reallocated an SSO project or something, so we expect to get that $50,000 and have that on an annual basis, so we put it in here. For reallocated funding, let's say our continuum of care has a plan, and a very ambitious plan, to reallocate half the transitional housing resources. So if that's your plan, what you do is you subtract $350,000 from that transitional housing line and put $350,000 if you're shifting to rapid rehousing in that rapid rehousing line. Again, you may not necessarily know exactly how you're going to do this. 5 years is a long time, but this is intended to represent what your plans as a COC are for how those funding resources are utilized 5 years from now. And then that last, the reduced funding column, hopefully you don't expect to lose too much funding over the next 5 years, but if you do expect to lose funding, that's where that would go. And then the spreadsheet will tally up what all the new totals are, so you don't have to do that addition. When you actually go into this spreadsheet, one thing you'll find is that there are some places where you can enter data and some places where the cell is locked, so you can't make changes. So for example, the new annual spending column of the blue and green section, those are locked, so you shouldn't be able to make changes there. It should do all those calculations for you. So those are all of the things you enter into the spreadsheet. Now let's look at how the workbook summarizes the information. So we're going to switch to the Funding Summary tab. And again, now we're into the blue tab, so you don't enter data here. This is just summarizing everything so you can see things. So this funding summary here just summarizes the different strategies and where you're getting resources to fund those strategies, what all the funding sources are. And again, this includes the different funding sources that you had entered on your lists tab, and it adds up all the money that you put in the funding detail tab earlier. And so this is just giving you a nice broad summary of where all the money is coming from that funds the various strategies. So again, this is a close-up shot so you can see this a little better. And what you'll see is that first row up there just gives you a sense of where the money is coming into your COC from. And again, this is all generated by the workbook. Let's go to the next tab, which is the Charts tab. And this Charts tab just simply has 2 charts on it. So let's look at these in a little more detail. Before we do, I just want to show you a quick thing here, which is that what you'll see on this very right side here is just a little sort of extra stuff. that's just there to help make the chart. So you just ignore that stuff all that stuff that's behind the charts. It's just the data that's pulled in to create the charts. But let's look at these charts in a little more detail. So let's zoom in on the first chart, the allocation of funding chart. And what this just basically does is it summarizes how you're spending money currently in the very broad categories, how you expect to be spending money 12 months from now, and then how you plan to spend money 5 years from now. Let's go ahead and look at the next chart, which is the funding sources. This just summarizes where all the funding is coming from in your COC in a nice little pie chart. Let's go to the next tab. This tab summarizes funding by organization, not by strategy. So we had entered those 6 organizations in previously, A, B, C, D, E, and F, and entered where their major funding is from. And so this just summarizes all that information here. And we can go ahead and zoom in on this so you can see that a little closer. So again, just a simple summary. So that concludes the presentation part of this. If you have questions after this webinar is over, then we have an email address for you to submit those questions to. Don't use that right now if you want to ask questions right now. We have a, you can just do it in the questions tab through the webinar software. So I'm going to go ahead and see if we already have several questions that have been submitted, so we're going to go ahead and work through those now. But I just want to remind everyone, if you joined a little late, the recording of this webinar is going to be, we'll send around the link to the recording of this webinar. Also, we have created a 10-minute video that's on YouTube, and we will send the link to that YouTube video around as well. I think the YouTube video probably does a better job of explaining everything in a concise way than I just did as part of the webinar, and also it's a little more fluid so you can see the screens actually working rather than just the screenshots I was able to do now. So let's go ahead and do the questions. So we have a question, we have several good detailed questions. So would site-based transition in place programs be listed under the category other under activities? So I guess this is more a question, this is a question about some guidance as to what the different categories, especially around transition in place and transitional housing programs in the activities section mean. So let me just quickly, I'm going to, sorry about this, but sort of go back through the screens and go to this screen so we can see what these various activities are, and I can talk about what some of the categories mean. So, and I think this is most confusing in transitional housing programs. So site-based programs are ones where where you have a building and say maybe there are 6 transitional housing units located in that building. At the end of the program, people have to leave when they hit their 2-year time limit. Scattered site, so let me actually go to that third category next. Scattered site not, and TIP stands for transition in place. Scattered site not transition in place is when you're using community-based apartments for your transitional housing program, and the people are not leaseholders, and they do not have an occupancy agreement that is similar to a lease, so they move at the end of the 2-year program. That's a scattered site not transition in place model. The scattered site transition in place model is one that's similar, except when they move into the unit, they either have a lease or an occupancy agreement that gives them the same rights and responsibilities as a lease, and they get to stay in the unit at the end of the program, and the provider goes someplace else. If you are, and I've heard about some of these, if you're running a program where you have sort of a site where but people can stay in the unit and they have the regular rights and responsibilities of a tenant while they're in that unit, and they get to stay after the 2 years is over and they have the lease, then I would put those under the category of scattered site transition in place program for the purposes of this. Next question. Should the information regarding the funding detail be for what only the organizations we are asking for funding for, or the entire COC? So the spending plan template is not just intended to be for COC-funded programs. It's intended to be for the various programs that are providing homeless assistance in the COC geography. So even if they're not HUD COC funded, the intention is to include them in the spending plan template. Now, I know that that's not always easy, and some providers, don't participate, and that can be a challenge. And so, understanding all that, this is, I think, I'd encourage you to do the best you can with those. But the intention is not just COC-funded programs, but any program that is providing homeless assistance within the COC area. So next question about the purpose of requesting information on funding sources, and that many local funding sources support entire organizations rather than just specific programs. And again, I think there's, I've sort of used a very simple example and described this as if everything is very sort of black and white and concrete. And I understand that it's not, and it's actually going to be very complicated, and there will be numerous judgments that have to be made as part of the when you're doing the template. But the idea here is to get a general overview of where funding is going, and to help facilitate the process of making COC-wide decisions about how how homeless assistance is done and how funding is allocated in the community. So there are going to be some, some funders who may fund an organization to provide various types of assistance, maybe an emergency shelter and a transitional housing and a rapid rehousing and a permanent supportive housing program, all together. And so, my suggestion in those cases would be to sort of, make an estimate, the best estimate you can, without really sort of driving yourself crazy over, doing very sophisticated allocation processes. But just, make the best estimate you can about, where that funding, sort of the places that funding is going. So next question. Here we have a question about our agency has multiple funding sources, including government, foundation, United Ways, and donors. Do we put in every funder supporting the program? So, you will put in the major funders as separate lines. So, for example, if you're getting Continuum of Care funding, there's a line for Continuum of Care funding. But obviously you get a lot of private donations, even like $20 and $50 donations. So you're not going to put each of those in. That would make this kind of ridiculous. You can either put that in an other category, or if there's some way that it would be useful for your COC to list those things, then use that. If you want to say like private fundraising, or maybe you have a community-wide funding drive, and if you want to separate those out into separate lines, then go ahead and do that. But I think you can use the other category, or maybe even if you want to create a category of just private donations, and just lump all those things together. But obviously don't individual donors and things like that. You don't want to have 1,000 lines for each organization on this list. You want to, categorize them as much as you can. Question about under strategy. So I'll read the question here. Under strategy, there's no option for multiple programs. For example, much of our funding is undesignated and we use it where it is needed. How will we put that in, or is this not intended to be inclusive? So the idea here is that you just, sort of do the best you can about estimating where those resources are currently being allocated and where, they will be allocated in the future. We don't expect this to be down to the dollar, and we don't expect people to, hire an accounting firm to allocate their stuff to the various strategies. The intention is to just sort of have a general sense, a pretty good general sense of where resources are going for different strategies. So for example, if you're that organization that provides, shelter, transitional, PSH, and rapid rehousing in your community, and you have funders that do all of them, just, do your best to estimate where that money is currently going and where it'll be going 12 months from now and where it'll be going, 5 years from now. But it is intended to, those would each be separate sort of lines in your funding detail tab. So you are creating a line for your organization, the shelter, the funding source and the amount, and then you're going to do all the ones for the shelter. Then you'll go to the transitional housing program, et cetera. Other questions. So I'm just going through these questions, and I think in some cases people ask similar questions. But there is one here about, please define the time periods for current funding and next 12 months. Is current the fiscal year 13 year or projected fiscal year 14 year? So the current year is the fiscal year, and I'm going to actually mention here that Kathy Robertson is on the line as well, and so I may ask her to help clarify this. But the intention here is to do the fiscal year 2000, so the current year. So right now, whatever year you are in for funding, for that to be the current spending, and the next 12 months would be the fiscal year 14 year, and 5 years from now, would be the fiscal year 2018 year. Now, it gets complicated because not every funding source is on the same funding cycle, so that can make things a little confusing. So again, I would suggest, whatever, when you're, literally when you're sitting down doing the template, whatever funding year that funding source is in, that's what you would use. So if you're on fiscal year 12 money for fiscal year 13-year funding for, one funding source, and maybe you're in fiscal year 14 for another funding source currently, then you would, use whatever, funding source you were in right on that date that you're filling this out, and then the next year would be the next year. So other questions? So this is actually, there's a very good question here about if we could tell how much state and federal funding will be available in the next 5 years. That would obviously make this much easier to do, and unfortunately I don't know the answer to that. I will say the federal funding has been looking grim of late. We're working on that, but unfortunately can't make any projections there. So another question for the services section, should we just include funding related to housing and homelessness programs? For instance, our DSS is a part of our COC and would have child care funding, but they're not a group we were focusing on for this funding. So this actually, this is sort of illustrative of a bigger issue, which is that there are programs that provide services and assistance just to homeless people. There are programs that provide services and assistance for low-income people generally that we certainly try to engage people in and utilize whenever we can. But that's a much bigger thing, and that would be much harder to do here. This template is really intended to focus on providers who are providing just homeless assistance with these programs. So, for example, the child care in this example, if you have a child care program that is just being operated by a homeless services provider to provide child care to homeless families, then you would put that in there. But if you have a child care agency that provides child care to low-income people generally, and you obviously try to get families experiencing homelessness into that child care program, those are things you would not include in this template. So again, I think there's some gray areas here, and you're probably going to have to use some judgment and make some guesses about how that's going to work. But for example, public housing is not, would not be included in here. Things like that are sort of just not intended to be part of the template. A few other questions here. The question here is the intention to capture the entire state's expenses and funding associated with homelessness to begin to consolidate services organizations across geographic areas, or determine total amounts of money to be allocated towards homelessness. So the purpose of this template is really to be a planning guide for your continuum of care. So I don't think anyone anticipates using this to sort of add up all the lines across the COCs to roll up into sort of one state thing, or to do checks to make sure that the individual COC entries add up to the overall state level. This is very much to start a conversation in your community and to help guide a conversation about how are we currently allocating resources, and how do we plan to allocate resources 5 years from now? How are we going to make those shifts? How are we going to, go from the COC we currently fund, and not just the COC, but the homeless system that we currently fund, to the homeless system that we want to be funding in the future. And so that's what this template is really intended to do. So if you have questions about, what does some of these things mean and where do we put things, I think that's the spirit you should really look at it in. And I also think that especially when you're filling out that blue section of the template that we had, I'll go ahead and head back to that section here. When you're filling out that blue section, this should very much represent the COC's plan for how resources will be utilized, not just COC resources, but overall resources. Other questions here. Also, there are some questions that are pretty specific that we may just answer offline. Where do we include the amount requesting in this year's DHCD COC-based ESG application? So again, if you're currently receiving funding, that obviously goes into your sort of current funding. And then again, for the next 12 months, and I realize that this is kind of this can be obviously very speculative, but you just sort of do your best to estimate the amount you expect to receive. Now the question is about sort of the amounts people are requesting, and I understand that there are parts when you fill out the application you request specific amounts, but for this template you're really looking at the amount you expect to receive, and maybe that's also the same amount that you're requesting. But it may not be.
And then, Norm, this is Kathy. Then there's also, you will need to list in the application the organizations that that you're recommending for funding and the amount of funding. But as Norm said, it will show up here in the current level and then the next 12 months.
So there's also a question about inflation rates, and so you know, people expect to. So the spending plan template does kind of assume that there's no inflation from between now and year 5, and we are just going to make that assumption for this. Maybe in version 2.0 of this, we'll add an inflator to make this a little more realistic. But for now, you just assume that, you know, there is not inflation between now and 5 years from now. Again, this is very much focused on being a planning document. So I don't think anyone's going to be, well, I'm sure no one's going to be audited 5 years from now to see how close they came to their spending plan template. There's a question about, do you include prevention services providers in the template? And yes, there is a line for homelessness prevention activities. It's listed under the permanent housing section, but it is intended to be included there. So a question about, and this is an important one to clarify, do you recommend that each member of the COC fill out this template and then have the COC compile into a composite report? So I think that the funding detail tab especially is one that individual organizations could fill out, and then somebody could you know, compile all of it into one template. I think the other parts are probably either things that one person could fill out, or there are things that really require some, you know, some discussion or some looking at the 10-year plan in your community or other planning documents that you have in your community. I think if you're a small COC with not that many organizations, that it may be that you could all sort of get together and fill it out. But I think in a lot of cases, it is individual organizations that are going to fill out the, especially the funding detail tab, and maybe, you know, provide some information about new funding that they expect in the next 12 months, and submit that to, you know, one individual or entity that's going to be putting that in and compiling sort of the master document for the COC. But again, the blue section is really something that, you know, I realize not everyone has done a 10-year plan that has 5-year projections about how resources are going to be reallocated. But you know, that, you know, starting to have that conversation and figure that stuff out is really sort of one of the points of most important points of doing this spending plan template. So at this point, I think we've answered most of the questions. There are, I think, a couple specific ones that we'll have offline. Again, if you have questions in the next minute or so, please feel free to type them into the questions box. If you have additional questions that you only remember after we hang up, you can feel free to email us at thecenter@naeh.org. Let me go to that slide here. Also, we will be sending a recording of this webinar to everybody who registered for the webinar, and we will also, more importantly, be sending the link to that 10-minute web video, which probably does a nicer job of summarizing everything. So I don't know, Kathy, do you have any concluding remarks?
No, I don't, other than thank you, Norm. That was very helpful.
Well, thank you, and thank you everyone for joining us, and look forward to you know, speaking with you all as we continue working on the project and various things, and hope you have a great rest of your day.